So you've decided to make a big financial leap and to get dental implants. Dental implants can be a huge expense, and when not inserted properly, they can really cause a lot of medical issues. So for some of you, just going to the dentist can be very, very scary, especially if it's been a while since you've been there, or you haven't had great success in the past with the dentist. Or maybe you're one of the ones that's just trying to get their smile back and you feel like you don't have a whole lot of confidence, and having some confidence going forward is very important to you. Regardless, you are in the right place. What's good, family? I am Ken the dentist, and I am here to help. Now you have a dentist right in your pocket to help you. So if you haven't had an opportunity to do so, this is a good time to subscribe. All right, now back to the top. 5 questions that you should ask your dental professional before having implants placed. All right. Question number 1, how experienced are you in dental implant placement? It is crucial to find skilled and experienced implant dentists who has a proven track record of success with implant procedures. This expertise will not only ensure a higher chance of success, but also ensures that any potential complications that you may have after surgery are managed effectively. All right, let's go. Question 2, what is the success rate of dental implant procedures at this particular practice? The last part of it is very, very important. Asking your dentist about the success rate of dental implant procedures at their practice, a reputable dentist will have a high success rate, and they will be very transparent about it. A good success rate reflects a successful and reliable implant process, minimizing the risk of failure or complications following treatment. A good idea is to see if the doctor has a portfolio. If they can give you this information will at least let you know what type of trainings that they've had, and you'll be able to see case by case of what they've. Now, I'll tell you, this may offend some people, but at the end of the day, you have to get that information so that you can know exactly what it is that you need to do before you get into placing implants, because your health is involved, and then also too, your money is involved. Next, what type of dental implants do you recommend and why? This is more getting to the nitty-gritty of understanding the type of dental implants that your dentist recommends. Not everyone is a candidate for dental implants, but if you are, by asking this type of question to your dental professional, at least it will give you a good sense of the materials and the size. These can be short implants, long implants, immediate load implants, or even conventional load implants. Really, with conventional, they're pretty much saying that the implants are placed and we wait a specific time for the bone to integrate before you add a load there. What you normally see on television is more of an immediate load, and that's when you go in one way and you come out a different way. Obviously, there's risks and things that you have to definitely deal with when it comes to considering either one. But my route, or the best route that I believe, is probably the conventional ones, because it gives you an opportunity to allow the bone to heal before you load it. I shared in the video before about if the implants are not stable, then obviously there can be a risk of fracture or other complications. Regardless of the case, your dentist should explain which one is suitable for specific reasons. Factors like bone density, jaw structure, aesthetics expectations can influence the type of implants selected, and your dentist should have a clear and knowledgeable answer to explain their recommendations. If they don't, you might need to seek out another professional who will talk about it, because again, they have your money and your health on the line. So you really need to make sure that you're certain about this particular procedure before you jump into it. Question number 4, what are the potential risks and complications associated with dental implants? I'm sure you've probably already done a deep Google dive. Again, some of you may have seen worst case scenarios. At least it's a good idea to hear from your doctor to say exactly what risks are associated with you, and someone will be able to also give you a consent letter prior to the treatment. It may be a good idea to take this consent home, read it by yourself, and then you can go back in with more questions if needed. But usually they have everything that you need to know within that consent form. It's essential to discuss potential risks and complications associated with dental implant placement beforehand, because your dentist should feel comfortable explaining these risks honestly with you, giving you a realistic understanding of what to expect. Question 5. What are the aftercare procedures and follow-up plan after implant placement? This is very, very important, because If you ask your dentist about this, the aftercare procedure and follow-up plan should be included in that. So when you start talking about risks and things like that, they should already have some type of follow-up plan after implant placement. A reliable dentist will provide you with clear instructions on post-surgery care, as well as pain management and oral hygiene practices following implant placement. Regular checkups should also be a part to ensure that the long-term success of the dental implant is good. And there you have it. Remember, your dental health is significant investment, and it's important to choose the right dentist and gather all the necessary information for a successful implant procedure. I know this was helpful, and I'll be dropping some links below in the description as well as in the comments. But remember, this is just YouTube. This is just for informational purposes, and you should not replace what I say with the dental advice of somebody sitting with you and being able to look at x-rays and health information, as well as anything else that they may need to figure out what type of implants work well for you. Consult your dentist for professional guidance. Y'all be blessed. I'll talk to you real soon.